Loud cheers could be heard in Tuscaloosa Saturday morning, not for a particular football team, but for kids with developmental disabilities. These children were playing baseball, many for the first time in their lives as part of Tuscaloosa's Miracle League. And with all that excitement, Samford's Ida V. Moffett School of Nursing seized an opportunity to bring its healthcare skills into town with a mobile health clinic.
One of the purposes of the mobile clinic is so that we can bring the mobile clinic to where the people are with disabilities. So if transportation's an issue, then we bring the van to them. And so when we come out here, like to the park, to the Miracle League, where they're already here playing ball, this is a good location to reach this population.
Cunningham knows firsthand the challenges of obtaining health care for disabilities. Her daughter, Leanna Grace, for whom the baseball field is named, has been diagnosed with disability. Aside from the common transportation issue, she says it's often hard to even find a healthcare provider willing to treat disability patients. So getting these Samford students immersed in this experience is helping to train a new generation of healthcare practitioners aware of and ready to treat people with developmental disabilities.
A lot of times we find that it is hard for people with disabilities to find a healthcare provider. And so by training our nursing students as well as pharmacy and exercise science, it just gets them here in the environment, it gets them around the kids so that they can get more comfortable with being around people with disabilities, so that when they graduate and they go out into the healthcare arena, they are more likely to be comfortable with people with disabilities and more likely to take them on as patients.
I love being exposed to things like this because it does open my eyes to the needs, specifically right now in Alabama, but also in my future as a nurse practitioner, because I'm getting this degree so I can help more people. So when I think about doing mobile clinics, I think about how I could go out to rural areas and meet needs of people that may be homebound or may not be able to access a clinic because there's not one nearby. So for this exposure, it's really beneficial, so I can really form my practice when I become a nurse practitioner, and I can start to assess needs that are here, but also that may be nationwide.
This is great to get out away from a computer and actually see the people that I'm helping, and it's great to be next to the nurses and just have that collaboration where everybody's coming together and with all our different knowledge and experience to try to help the community as best we can.
In addition to providing health screenings, the students also became the teachers as they educated the families on how to maintain good health in the future.
What else did you do? Did you go over to have your foot measured?
Yes.
Yes. And then what else do you plan to do? Are you going to go over and maybe learn about washing your hands?
Yes.
And when you wash your hands, how do you wash your hands? That's right, that's a great example. I think it is wonderful to have the opportunity to receive medical assistance here and for them to use all medical aspects that they have just to ensure that we have our children on the right track for their health meaning. Is very meaningful to us as parents, and we're grateful to them for coming out to share with us today.
By the end of the day, the students, the patients, and their families agreed they had a great time making friends and learning how to maintain a healthy lifestyle. They also noted that others can get in on the fun as well.
It's not exclusive to healthcare providers or families. It's something that everyone should be able to experience and see the challenges these kids face and the way that they overcome. So I think it's just a great experience, and I'm thankful to be a part of it.
We're using team sport. They cheer for me, I cheer for them, and we just make friends.
I had a say it real loud, blast.
Blast.
All right.
Yeah, home run. Good job, Mr. Nate.
I'm Nathan Troost, Samford University.